think going by the simple to the most complicated test that we have. The simplest test, and which also very sensitive, is the mammogram. Easily available everywhere. Patient can have access pretty much anywhere. Also, sometimes self-referring to a simple mammogram. It takes less than 5 minutes. It's not that painful, and it provides us information on, again, subtle changes. Then if something is abnormal, then we will go to a second level with an ultrasound. So we will use an ultrasound to study a little bit more in depth those changes that we see on the mammogram. As a third line, when we have a diagnosis, then we want to use an MRI of the breast to measure, assess the involvement of lymph nodes and see how much this disease is involved in the breast. For some patients, the MRI is involved in the breast. For some patients, the MRI is useful for screening. If they're considered very high risk, we are starting their screening when they're very young and the breast is dense. That's when the MRI comes into the picture. But because it's an expensive test, it takes up to 40 minutes to obtain, it's not a test that we will use for screening. Screening, we use something very simple and quick and cost-effective, which is indeed the mammogram.